Hello, I am Dr. Rajasekkhar Pappuu, Orthopedic Surgeon from ONUS Robotic Hospitals, Hyderabad, Champapet. Today, we will know about implant failure. What is an implant failure and when do you call it an implant failure? Most of the times, whenever somebody has an injury or a trauma, when they meet with an accident, they break their bones. So these bones are treated by different ways. One of the ways is by operation. The other way of managing it is by conservative method. What is a conservative method? Conservative method is usually treated by without operation by applying a plaster or just a bandage when your fracture does not require much of the care or stabilization. So in most of the unstable fractures, your fracture is treated by using an implant. That implant might be a plate or a nail or some other thing or an X-fix. So these things are decided based on the fracture type and geometry and position of the fracture. Whenever you get operated by an implant, so there is a particular time when the fracture heals. So the main function of the implant is to hold your bone in position and help the bone to heal. It does not take the load. Most of the times what happens, an implant fails because when you take weight bearing earlier than the doctor has advised you take the load. So most of the implants fail because you have taken load, because your bone is not ready to take the load. Implant only holds the bone in position. It does not take the load when you are having a fracture. So you have to wait till your doctor advises you to take the load. Secondly, the implant fails when your bones are too porotic. That is osteoporosis. There is no calcium, much calcium in the bone, and there is only matrix. So when there is less calcium, the screws does not have a hold in your bone. So when you take a load, that screws comes out of the bone or they break. So whenever there is a fracture and whenever there is an implant, whenever your bone is weak and osteoporotic, these implants fail because you take load earlier than your doctor has advised. Another thing is when you have a nail inside, that nail gets loosened when your bone is weak or when you have taken the load earlier than that, the fracture gets overriding and then your screws break. So implant breaks. And when there is an infection also, sometimes implants won't hold because screws gets loosened and come out. So there are many different ways of implant failure which you require a secondary surgery to again stabilize your bone. So be careful, don't get overactive, over enthusiastic to take load so that you can walk early. It's not like that always. You have to wait for your fracture to heal to return to your complete functional activity prior surgery. So be careful, don't take any extra steps before your doctor advises you. Thank you.